This is a beautiful example of one of my favorite types of surgeries when I'm working with African-American female patients that have traction alopecia. This woman did fantastic. We did an FUT as well, a strip excision, which I typically like to do with my female patients that are of African-American descent if we need, again, to get a large number of grafts. Because when we're trying to fill these areas in, the last thing you want to come up with is a small graft count. So we ended up doing her. This is her result after 1 year. If I'm not mistaken, it was just under 3,000 grafts that we're able to transplant on this individual. And you can see her from both examples and both sides. And she's elated. Again, it's one of my favorite surgeries to do because the impact is so great. But it gives you an example of what can be done both with Caucasian as well as African-American patients if you approach it correctly. Obviously, with a female patient, they're not really going to be interested in doing FUE. They don't want to cut all their hair off. And not for nothing, but it obviously works better to do a strip excision or an FUT in these particular individuals.